What's going on, guys? It's me. Today is I think it's September 20th. It's Thursday. Whatever Thursday is. So I am 9 days post-op with Dr. G. And if you're watching this because of that, you might be bummed that I'm wearing so many clothes right now. Went to Florida. Everything was great. I had surgery on September 11th. Yeah, no problems or anything like that. Didn't have a whole lot of pain after surgery. Mostly like some soreness. I didn't really even feel like I had a ton of swelling. Yeah, like things were going pretty good. I got my drains out and all this crap off of me on Monday of this week. Flew back later that day, and then Tuesday I was in Massachusetts at my mom's house with my girlfriend before we drove back, and my mom, who's a nurse, helped my girlfriend take like the bandages off. We changed the bandages, and I was gonna get in the shower for the first time. And I went to the bathroom. I got in the shower, and I'm not sure when it started happening. If it was like right when I got in the shower or when I was in the bathroom or whatever. But I started feeling like the left side of my chest felt kind of funny. And I didn't really think anything of it, and I was in the shower, and I looked down at my chest, and it was huge. The left side of my chest, like, just swelled up like a balloon, like, crazy. One thing that Dr. G tells you to watch for is, like, if things to call me for, if one side of your chest looks twice as big as the other one, so that's what happened. All of a sudden, like, it was like that. It was super swollen. It felt like the left side of my chest was gonna explode. Scared the shit out of me. I had to get out of the shower. I didn't really shower. I got a little bit wet. I thought I was gonna pass out. The room started getting kind of white. I had to sit down. I had to lay down. I got super lightheaded. I've never thought I was going to pass out. I felt like the left side of my chest was just going to keep growing, and it was going to bust open. So, my girlfriend, sorry, the cat is getting me. My girlfriend called my mom, who was just downstairs. My mom came up, got her blood pressure cuff, which is great. My mom's a nurse. And yeah, so she started taking my blood pressure, which made me feel better because she was worried that, my blood pressure would drop if, I was, like, bleeding internally. So my blood pressure stayed the same, which was good. It was fine. It was, like, a normal level. And we called Dr. G, and we're waiting to hear back. We got Jessica. He was in surgery, of course. So as soon as he got out of surgery, he called and checked to see what was going on. I think if I had still been there, he would have wanted me to come in and see me. Stop. But I'm nowhere near Florida anymore, so I just laid low. We put bandages back on, and we re-wrapped my chest with the ACE bandage. Wrapped it nice and tight to sort of get some compression on there. If you have swelling post-surgery, you want to use compression to get the swelling to go away. You don't want to use ice. Ice can actually cause your nipples to die and fall off, so don't use ice if you were to ever have swelling post-surgery. So we did that, and I started feeling better. There's still a lot of swelling in my chest, which is why I still have an ACE on. The swelling has gone down. But yeah, so that's what happened. Dr. G thinks that it could be a seroma, which um, basically means that there's some fluid in there that now that the drains are out, can't go anywhere. So, and he said, it can't happen suddenly; it can happen gradually. Clearly, this was very sudden. It happened within a matter of minutes. That my chest was gigantic. And one thing he asked when he called back was, "Well, does it look like?" He was talking to my girlfriend. He said, "Does it look like there's a watermelon or a grapefruit sitting on his chest?" And it didn't. It more looked like half a grapefruit, which was still like, if you're looking at both sides of my chest, like, it looked pretty extreme compared to the right side of my chest. But it didn't look like there was a watermelon sitting on my chest, which definitely made me feel better. Like, okay, it could be worse. Apparently, it could look like there was a watermelon sitting on my chest. We changed, my girlfriend and I took the ace off, changed the bandages, and I did get in the shower last night, and we were both kind of freaked out because that's when it happened the night before. So, she stood right there with me and helped me wash my hair. I'm really tender on the left side now. It feels sort of like a big bruise all over. You can't see any bruising. Apparently there's some bruising under my arm, but that's sort of how it feels. It doesn't feel like sharp pain, it's not throbbing or anything like that. But it's pretty tender, so I'm taking it really easy. I'm certainly not very active. I'm still sitting around, watching TV, and not doing much of anything. So, trying to take it easy. Try not to do anything crazy. I'm really not moving my arms a whole lot. So, that's what's going on with me. I'm sorry that I can't show you guys my chest, but soon enough. Other than the fact that this happened, I'm still really happy with the results. I wouldn't do anything differently. I wasn't doing anything before that happened to make that happen. It can happen, regardless of how careful you are. And I've been super careful and really gentle. I wasn't using my arms a whole lot before that anyway. Certainly wasn't doing anything that I shouldn't have been doing. So, just something to watch for. It is surgery. It's a serious surgery, and these things can happen. So, yeah. Like I said, I'm still really happy with my results. My chest does look pretty sweet, other than the fact that it's super swollen on the left side now. Hopefully that goes away, with time. Dr. G said that if it doesn't, I may have to go in and have them aspirate it, which means that they would put a needle into the left side of my chest and, pull some of that fluid out of there, which, I don't really want, but if that's what has to happen, okay, I'll do that. For now, having the ace on there feels pretty good. And the swelling has gone down some, it's still swollen, but, even from Tuesday we wrapped it up, and last night, Wednesday night, my girlfriend and I took everything off and changed everything, and we could see, we'd put the bandage over my nipple, which is a fairly large bandage, and because my chest had been so swollen, last night when we took it off, the bandage kind of looked kind of wrinkled, because, my chest had been out like this, and it had gone back in, so the bandage kind of crumpled back in on itself a little bit. Not extremely, but at least, we could see that it had gone back down, and that kind of reassured that, in fact, the swelling has gone down, even though it's still swollen. Yeah. So, definitely scared the shit out of me. Scared the crap out of my family, too. But I'm glad that my mom and my girlfriend were there. It's something to be said for not being alone after you have surgery, even a week after surgery. So that was a week after surgery. That was exactly 1 week post-op for me, so, and everything had been going great. I really can't stress that there was nothing, funny going on there, so, anyway, even though I can't show you my chest today, my girlfriend was lovely enough to shoot, some video before Dr. G took the drains out and everything. Right? Yeah, anyway, so she took some video. I'll show you guys that. I'll put that on here in a second video, so check that out. Thanks again to my girlfriend for doing that and taking care of me all week. She's been awesome. I'm super lucky to have her, and wouldn't have been able to save up the money without her, so thank you. Anyway, hit me up with questions. Certainly, I'm here sitting around. Hope you guys are doing well, and I'll make an update soon. See you guys. I have to get the